This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning, Dr. Wissam Gharib, Mon Health Heart and Vascular Center, and Anthony Jackson, Director, Emergency and Trauma Services, Mon Health Medical Center. Good morning, gentlemen.
Good morning.
Good morning.
Guys, thanks for taking some time this morning. We're going to be talking emergencies and the heart. Makes sense to bring those two things together. We'll get into the subject at hand in just a moment. But first, we'll let you guys talk about yourselves for just a minute. Eeny, meeny, miny, moe. Anthony Jackson, Director of Emergency and Trauma Services at Mon Health Medical Center. After my highly scientific way of choosing which one of you will go first, tell us a little bit about yourself, your background, education, how you ended up with Mon Health.
So I have been in emergency services for about 10 years now. Just started here at Mon Health just about 4 months ago now. Previously worked as the Director of Emergency Services at WVU, Camden, Clark, and Parkersburg, West Virginia. Originally from Akron, Ohio, and my education is a bachelor's in nursing, a bachelor's in business, and finishing up a doctorate in nursing leadership.
And Dr. Gharib, we've spoken just a few times during the course of this program, but remind people about your background.
So I've been in Morgantown since 1990. I went to med school and fellowship here in Morgantown at WVU, and I practiced interventional cardiology and structural heart at WVU for many years. About 6 years ago, I moved over to Mon, and we've been practicing here at Mon since, really just trying to bring the best, newest, and most advanced technology to people here in West Virginia.
Well, February, which is, believe it or not, just a few days away, is Heart Month, and we're going to be talking a lot about the heart and heart health here over the next several weeks. But, Anthony, heart attacks are unfortunately way too common in West Virginia and across the country. West Virginia ranked one of the highest in the nation when it comes to prevalence of heart attacks. Can you put some numbers, some data next to what, unfortunately, an assertion we already know?
So the biggest thing is that I think there is a mentality that people have sometimes non-normal features and signs of a heart attack, and they're reluctant to come in. So beyond the numbers, I would just encourage individuals that if they have any signs of a heart attack, which could be chest pain, shortness of breath, for females, that could be arm pain, jaw pain. I would just encourage people to go ahead and come in and get checked as soon as possible. Because, again, a lot of times you have a lot better outcomes if you can get checked right away.
Dr. Gharib, one of the things I've actually heard, had friends, people I know who will go in for a checkup, go in for something else, and there will be signs that they have had small heart attacks, I guess, in the past, and they never knew it. When you see these, and please forgive my comparison here, in the movies, it's a very dramatic thing. Is it possible that something like a heart attack can occur and you go, oh, my arm hurts, and then you don't think anything of it?
Yeah, actually, you'd be surprised at how many people actually have a myocardial infarction and don't know it's a heart attack. So that is something that we're concerned about. And this is why we recommend, regular checkups, regular follow-ups, because a lot of times someone has indigestion and they feel bad for several days, and they blow it off as to something that is, nothing important. But if you don't follow up with your doctor, they don't do an EKG, they can't figure out what's going on. And unfortunately, because cardiac disease is so sometimes very subtle, people just think, oh, I'm getting older, I'm just more tired, I'm more fatigued, where it's actually not that. It's actually heart on there's something going on. That's why we strongly encourage prevention, regular follow-up, etc.
Talking to Dr. Wissam Gharib, Mon Health Heart and Vascular Center, Anthony Jackson, Director, Emergency and Trauma Services, Mon Health Medical Center. On the other side of subtle is, for pretty good comparison, it's been in the public eye recently, is what happened to the Buffalo Bills defensive back Damar Hamlin. Sudden cardiac arrest right there in the middle of a football game. So, Dr. Gharib, on the other side of that, that's a very dramatic example of what happens during a cardiac arrest.
Yes, it is. And unfortunately, a lot of those end up in death, end up in a fatality. So cardiac arrest basically means your heart goes into a super fast rhythm called ventricular fibrillation. And unless something is done immediately, like within moments, a lot of patients do not survive. So that's where it's important to have, if it's witnessed, if it's someone's around and you have an AED, which is a defibrillator that is an automated defibrillator, then you have a chance of saving that patient. But unfortunately, cardiac arrest quite often is fatal, and it needs to be treated immediately. This is why we strongly encourage the community, all people, to learn CPR. Because as you notice with Hamlin, very dramatic, and had he not had immediate CPR and a defibrillator, he wouldn't be here.
Are there signs that cardiac arrest is coming, or is it just that sudden?
So normally there are signs. Normally, cardiac arrest, the most common cause of cardiac arrest is due to a heart attack. And most often, people that we see that come in with a heart attack, if you actually quiz them, in the vast majority of patients, they've been having some subtle symptoms that have occurred up to 2 weeks prior. So that's why it's important for us to pay attention to those types of things. Look at if I'm having something different happening, like I'm having discomfort in my chest, I'm having more fatigue, I'm having indigestion, shortness of breath. Those are the kinds of signs, warning signs, impending us having the heart attack, which in a certain percentage of the population ends up in cardiac arrest.
Are the signs the same in men and women, or can those vary?
So cardiac arrest is cardiac arrest, but the signs of heart attacks, they do vary. Men almost always, and I say almost, read the book. We have the very traditional signs: chest pressure, heaviness, radiating down your left arm to your jaw with shortness of breath, nausea, sweating. Women can have those signs, but a lot of times they come in with a very variable type of symptoms, and dare I say, they're tougher than us. So in general, women are more likely to say, I'm okay, this isn't very painful. And a lot of times their symptoms and signs are very subtle. So that's why anything out of the ordinary, I think it's time to cry wolf. I would rather someone cry wolf than come in with a massive heart attack that they missed, or come in from a delayed heart attack. Because the sooner we get to them, the better off we are. The sooner they get to our facility and we can treat their issue, the more muscle we can save from the heart.
And Anthony, Dr. Gharib kind of touched on treatment for sudden cardiac arrest. The patient who is suffering cardiac arrest, they need immediate attention. What can be done in those first few crucial moments?
So like the doctor said, immediately in an actual cardiac arrest, we're going to be starting compressions if necessary, or trying to, again, if necessary, recharge the heart. So it would depend on what type, but again, like you said, BLS, learning basic life support would be able to keep the person's heart, as healthy as possible until you either get to a facility or the paramedics arrive, and then again, the AED would be the next step if that's what is called for as far as a abnormal heart rhythm.
And just how difficult is it to learn CPR? Dr. Gharib mentioned everybody should probably know it. I mean, it seems like something that would be pretty easy to pick up in the course of a safety class, Anthony, or I'm sure these are offered all over the place.
Yeah, so a lot of schools, businesses have started to actually offer that to their employees. And no, it is not difficult to learn. The biggest thing is first start with your compressions, and then they also teach about giving the breaths. But even if you are uncomfortable or don't know how to give the breaths, the compressions are very, very important.
Talking to Dr. Wissam Gharib this morning, Mon Health Heart and Vascular Center, and Anthony Jackson, Director, Emergency and Trauma Services, Mon Health Medical Center. Got to squeeze in a break, and we'll be back with more Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Wissam Gharib, Mon Health Heart and Vascular Center, Anthony Jackson, Director, Emergency and Trauma Services, Mon Health Medical Center. And I'm going to probably butcher this. Dr. Gharib, what exactly is Camioto cordis? Did I get that anywhere close?
I think you and the rest of the United States have been searching that quite often since that happened with Hamlin. So this is actually a pretty rare thing that occurs, but it occurs often enough that, we need to be aware of it. So usually it occurs to young adults where you have a sudden hit to the chest. The most common thing that we see this is either baseball, and then the next one is softball, where you get hit in the chest, and it's a very inopportune time in the cardiac cycle. So, as the heart beats, you have certain electrical movements that are occurring in the heart. And when you depolarize, which means, you release all that energy to make the heart squeeze, and then the heart just starts to relax at the terminal T. If you get hit at the right time, unfortunately, a person can go into cardiac arrest. And that happens, unfortunately, a lot with this softball, baseball, like we're talking about. And then those patients go into cardiac arrest as young athletes. And the only way to bring them back is CPR, cardioversion, the defibrillator. It is a rare occurrence, but it does occur often enough that we need to recognize it, be aware of it. And that's why there's a lot of push in a lot of communities to have AEDs in these types of events.
Yeah, I'd heard of it actually more related to baseball, softball than I ever heard it related to football because of that. And usually it's a pitch or a line drive.
Yeah. Football.
Yeah. Usually where I've heard it's been either a pitcher or a third baseman, honestly, that's taken a line drive and just couldn't react. And it sounds just, it has to be just that exact right timing. But like you said, it happens just often enough that it's on people's radar. And like you said, I think more, especially at the high school level, they're taking more precautions to have those portable defibrillators on scene just in case something like that would happen.
Exactly.
And so back to, we were talking about heart attacks, cardiac arrest, and I think people probably have heard this time and time again, but it doesn't hurt to remind them. What are some of the common risk factors, Dr. Gharib, when it comes to heart attack?
So common risk factors: lifestyle, diet, exercise, and then some of the things that we look at, that are very important, like your family history. If your father or mother or grandfather had a heart attack, you're at a higher likelihood of having a heart attack. If we don't get enough exercise, if we don't eat the right kind of diet, if we don't, and how do we get all these things put together? By going to your doctor, looking at your risk profile, and then saying, hey, you need to be on this medication, or you need to be doing this types of exercise, et cetera, et cetera. So those are very, easy to recognize. Some of them you can't do anything about. Those are the unmodifiable risk factors, like your family history, like being a male. Those are risk factors that you can't change. But there are other things you can change, such as your cholesterol, your blood pressure, getting it treated, exercise, and diet.
And Anthony, I can only speak for us guys. Well, I guess I can only speak for this guy, but for guys in general, I'm pretty certain we'll come up with every possible excuse or reason or remote possibility why we might have discomfort in our chest. It is not our heart. It's because I was digging a ditch yesterday, or we'll come up with whatever we can come up with, Anthony. But the point is, if you are having some of the symptoms we've talked about, like Dr. Gharib said, like you've said, go get it checked out. Better safe than sorry.
Yes, and normally when you come in, we'll usually get your EKG within the first 5 minutes of your visit, and then we'll also draw some labs, and that information comes back pretty quickly as well. So, again, I always tell people when they ask me, I say we'd rather have you around, and we'd rather just get those tests done quickly to find out if we can just rule that out right away.
Got to squeeze in our final break. We'll be back to wrap things up. Anthony Jackson, Director, Emergency and Trauma Services, Mon Health Medical Center, and Dr. Wissam Gharib, Mon Health Heart and Vascular Center. More Mon Health Talk in a moment.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a couple of minutes left with Dr. Gharib, Anthony Jackson. Dr. Gharib, about 30 seconds here for you. What's one thing you want folks to take away from our conversation today?
When you step into Mon, you're really stepping into world-class healthcare. And, everybody says they're the best. Every place you talk to, every advertiser says that. But when you're recognized nationally as being one of providing the next level type of healthcare that is world-renowned, that's what makes us different. Mon Health is one of the 24 centers of excellence designated as a heart care center of excellence by the American College of Cardiology. That means we're providing high-quality, comprehensive health care that's second to none. And that's the types of things that we're able to offer to people here in West Virginia.
And Anthony, same to you. About 30 seconds here. What's one thing you want folks to take away?
Just reiterating again that we want you to come in as soon as you have symptoms, and we are here to serve you. We have great providers in our emergency department, and we have great nurses, and we are ready to take care of any of your healthcare needs.
You can always get more information, monhealth.com/heart. Dr. Wissam Gharib, Anthony Jackson, appreciate the time this morning, fellas.
Thank you.
Thank you.